What is ventricular septum defect? To understand VSD, it is important to understand the structures of the heart and how the heart functions. The heart is a four-chambered muscular structure that pumps blood and therefore oxygenates the body. The top two chambers are referred to as the left and right atrium. The bottom two chambers are referred to as the ventricles. The structure separating the heart into the left and right side is the septum. In ventricular septum defect, the septum has not properly developed and therefore a hole is present in the wall between the left and right ventricles. The presence of this hole disrupts the proper flow of the blood and allows the blood to flow backwards. This means that oxygenated blood can mix with unoxygenated blood, therefore being pumped out to the rest of the body. In normal development, the wall between the chambers close before the fetus is born, so that by birth, oxygen-rich blood is kept from mixing with oxygen-poor blood. When the hole does not close, it may cause high pressure in the heart or reduce oxygen to the body. The most obvious evidence of the lack of oxygen is cyanosis. Cyanosis is a bluish-gray color of the skin, often seen in the mucous membranes of the mouth, nose, and around the lips, and in the fingertips and toes. A healthcare provider may also hear an abnormal sound when listening to the patient's heart, called a murmur. What causes VSD? The cause of VSD is widely unknown, but it is thought that mothers with diabetes or mothers who smoke, drink, or do cocaine during the early weeks of pregnancy may also contribute to the development of ventricular septum defect. Environmental factors such as certain infections and chemicals and chronic illness may also be a cause. Although some babies will be diagnosed during gestation or at birth, sometimes the diagnosis is not made until days, weeks, months, or even years after. In some cases, it may not be detected until adolescence or adulthood, because sometimes the defect is so mild that it does not show any outward symptoms. There has been significant knowledge gained in recent years about the roles genetic plays in development of heart defects due to a growing population of these patients surviving into adulthood and beginning to start families of their own. VSD in newborns and infants. According to ismyheart.org, 1 out of every 100 babies born each year are born with a congenital heart defect. Congenital heart defects are the #1 birth defect and the #1 cause of birth defect-related deaths worldwide. Nearly twice as many children die from congenital heart defects in the United States each year than from all childhood cancers combined. Yet funding for pediatric cancer is 5 times higher than that for congenital heart defects. The lack of funding means a lack of research for the cause and possible treatments for congenital heart defects. This increase of emotional stress on the family can cause an additional strain to the family as a whole. Oftentimes, babies born with VSD have to undergo surgery soon after birth. Sometimes this initial surgery has to be followed up by multiple surgeries. Some defects are so extreme that a heart transplant becomes necessary. These children often deal with problems associated to their impaired blood flow they may tire easily due to their lack of oxygen to their body tissue and become short of breath or even faint when exerting themselves. You may even see them squat frequently to ease their shortness of breath. These children often have to undergo several different types of procedures to monitor their heart defect that other children do not experience. This includes frequent blood draws, chest x-rays, EKGs, a test that records heart rate patterns, echoes, a special ultrasound that uses sound waves to take pictures of the heart and allows the doctor to visualize the extent of the defect. These procedures are not only uncommon for most children, but can be scary and emotionally and physically draining on a child. Living with VSD is not just a difference of inward structure, but it also comes with many struggles. Today, many adults are living past their childhood and teenage years into adulthood with VSD. They struggle to find a place to belong to get adequate health care. They no longer qualify for pediatric care, but many adult cardiologists are not trained in the proper management and treatment of adults with this condition. In the past, VSD was typically seen in children. However, these adults still have to have antibiotics for dental appointments and frequent checkups. Even in adulthood, the need for surgery may still be present, and they remain at an increased risk for infection involving the heart and its valves. In conclusion, as a whole, VSD patients have to live with several restrictions and lifestyle modifications that the average person does not have to. Things vary from person to person, from case to case, depending on the severity of their defect and their treatment plan. They must constantly be aware of their health status and their need to avoid infection at all costs. They require frequent checkups with their cardiologist to monitor their conditions, and the threat of possible surgery is always present. While all of these things may be stressful for an individual, the incorporation of these modifications can help the person to lead a relatively normal life.